So, good morning. We did a little bit more work on the numbers coming up front, and they're still not exactly where we want to be, but I think they're starting to make the case. And thank you, Joe Riley, for that suggestion. The case is something that I've made verbally many times, but making something verbally just doesn't do the justice of, a picture's worth 1,000 words. And I think the point was clear. I hope the point was clear and obvious. Despite all the disruption we've got going on and the impact on lives, heart attack and stroke is still killing more people and disabling more people than COVID-19. So, but speaking of COVID-19, a lot of interest, a lot of focus on it, a lot of people wanting to hear information about it. Speaking of people wanting to hear information about it, I've had many questions about pregnant women and coronavirus. And I've said many times, everything I'm reading from China, from New England Journal, from everywhere else is saying it's not that big of an issue. But again, it's sort of like that first concept we brought up. A picture's worth 1,000 words. So you can say something till you're blue in the face, but until you actually start showing numbers, facts, pictures, then people start to focus. If it's just all verbal, it's hard to focus. So today's feature is going to be pregnant women, and they're asymptomatic with coronavirus. Upcoming topics, as usual, we'll always continue to do updates on effective COVID-19 treatments. Janice was telling me, for example, that right next door to us over at the University of Louisville, they've come up with some sort of mechanism for reusing serum. Never heard of that. I haven't had time to look it up. It's very interesting, though. And what are they doing? They're pulling the serum back out? I don't know. Serum does have a lot of opportunity. Unfortunately, it's just not that scalable. It's not scalable like a vaccine. But you know what? Serum's available now. Vaccines are not available till a long way down the road. We'll have some updates on things like hydroxychloroquine. That's starting to get some criticism out there. Still being used, like remdesivir being used, several other things. And obviously, that perennially popular topic, supplements. Vitamin C, perennially, I need to work on that pronunciation, perennially being criticized, hotly debated, but also having a lot of folks that say vitamin C is just the best thing ever. I do use it, by the way. In fact, speaking of supplements, I just redid before we started here, I redid my couple of my videos on berberine and prediabetes, berberine and diabetes. In fact, there are several, just a quick digression on it, there are several studies that have shown berberine being as effective as metformin and other oral hypoglycemic medications or oral diabetic medications. As with any supplements, prescription medicines, even surgery, none of those are going to have an impact like losing 5 pounds. You can't supplement your way out of a lifestyle issue. But back to COVID-19 and back to our topics for the day. Just real quick, before we get into the program, just a reminder from our largest sponsor, me. We're making telemedicine available. The doctor's in. Even though you may not be able to travel, you can still see a doc. One of the things you need to think about when you do see your doc, whether it's telemedicine style or even if you go in to see the doc, ask them about how they prescribe. Because if they're not e-prescribing, they're still set up for the #1 cause of prescription errors, and that's just bad physician handwriting. So, as we've talked about many, many times in this channel, medicine is one of the last places where you'd want caveat emptor, Latin word for buyer beware. But unfortunately, medicine is one of the biggest places where we have buyer beware. Folks that watch this channel do have to wade through and sit through a lot of technical stuff, but they do it because they know that it protects their lives. How does telemedicine work for us? We've got 15 to 30 minute slots. You just go to our website, and Carl, what you should do, if possible, is go ahead and get a picture of our website where people can sign up, where they click the button. We also have same day and urgent slots available. You schedule those with Michelle. People give me a lot of feedback, and it's true. There's no question. I don't take insurance, so what we do is significantly expensive. The docs that folks are seeing don't really understand the subtleties of blood sugar, the thing that kills and disables more of us than anything else, even in this world of coronavirus. So one of the things that we've done, continue to try to focus on a public health perspective to make this information available to a lot of folks. And we've gotten webinars now down to $179. So most of us spend that on groceries, unless we're going every day or more than once a week. So think about it. What is your subscription to Hulu or Netflix? And think about a one-time price for $179 and your health. So we'll go to pregnant women and coronavirus right after Carl gives us this the water ball. So we're going to cover a couple of studies. One of them I asked Chris, I read and asked Chris to create some slides for it. I used to do those. Now Chris is doing them, and it's a huge, huge contribution. Thank you, Chris. But this was the New England Journal, and as I said, it was the article that I kept quoting. In the New England Journal study, there were 215 pregnant women. New York observed between March 22nd and April 4th. 33 were positive. I think this is a different study, but anyhow, the New England Journal, I think, came from China. There have been several studies at this point. 33 of those 215 women were positive for SARS-CoV-2, the coronavirus that's causing this problem. 29 of the 39 had no symptoms. 3 of the 29 later developed fever, but 2 were presumed to have endomyometriosis. In other words, an infection that really probably had nothing to do with this. So again, it's not even like the case with kids. As we saw when we covered earlier, it's a similar story that you have with kids. Kids are getting infected, there's no question. And on kids, they did children, they did chest x-rays and found that almost all of, or the majority of these kids had evidence of some inflammation in their lungs on chest x-ray, but no severe disease. There were 3 deaths out of several hundred among the children, and those were all due to something else. Similar setup here with the women, although they didn't really talk that much about chest x-rays. Chest x-rays are not that much of a standard these days for routine maternal care. What you see is that, yep, you have folks developing infection, but just not a lot of symptoms. It would be interesting, again, if one of these studies will come out and actually do chest x-rays on the women as well, the pregnant women, because you have to wonder, do they have that ground glass appearance, that evidence of at least mild inflammation in the lungs? That's what's killing people once the people that do develop full-blown COVID-19. It's that inflammation in the lungs, and it just goes rampant. So, first study, New England Journal study. Again, 215 pregnant women, New York, March 22nd to April 4th. Several of them positive with SARS-CoV, but just very few symptoms. The 3 that did develop symptoms appeared to be something else. In another study in the American Journal of Obstetrics and Gynecology, 43 pregnant women were positive, but most of them just have mild illness, and the others don't have anything at all. No symptoms, asymptomatic. A means not in these terms, these medical terms, and symptomatic, so no symptoms. So a lot of people are surprised about that. They don't expect it, and I think that's part of the reason that people keep asking the question, well, what about pregnant women? What about pregnant women? We've heard a lot about it. We've seen it. It's a major concern. Well, here's what the issue is. It has been a major concern for seasonal flu. A lot of the seasonal flu viruses hit pregnant women hard, and their kids as well. Both of these studies show an unexpected reaction among a demographic that's more susceptible to serious illness like flu. Flu is more likely to make pregnant women very ill and more likely to be fatal. Again, there are several silver linings. We had a whole discussion about the silver linings associated with the flu. With COVID pandemic. This is one of them that we didn't mention, by the way. And why is it happening? We don't know. We don't know that. So, Carl, you want to show that clip from CBS?
New research sheds light on how the coronavirus may affect pregnant women. 2 New York City hospitals tested more than 200 women admitted for delivery, whether they showed symptoms or not. The results published just this week in the New England Journal of Medicine revealed nearly 90% of the women who tested positive showed no symptoms at all.
Dr. Dina Goffman is with the Columbia University Irving Medical Center. She co-authored a new study of more than 200 pregnant women at 2 New York City hospitals. 33 women tested positive for coronavirus, but 29 of them showed no symptoms.
If we're not checking, we really do risk missing people who are carrying the virus.
I'm 37 weeks pregnant. If I come in and test positive, would you recommend separating my newborn from me?
For a mom who's asymptomatic and feeling well, we think there are ways to potentially keep them together to allow for some of the bonding.
So far, studies have not shown coronavirus passes to the baby from the womb or through breast milk. But Dr. Goffman says asymptomatic mothers should wear masks while around their newborns.
So there you go. There's not that many viewers today, only 34, and I think one of the major reasons is you get a lot of focus based on the topic, and I think we're not the only folks that know that, you know what, pregnant women are just not having a huge issue in terms of COVID-19. What we'll do is go ahead and open it up now for comments, and then maybe finish early today. Dennis Williamson's greetings and waiting. Farouk Fark. Farouk, is low levels of oxygen in the blood responsible for the massive clots in lungs which end up in heart and brain of patients that kill them? It's not totally clear. It's a great question. There's a thing called DIC. That stands for disseminated intravascular, in other words, in the blood, coagulations or clotting. And that's one of these things that we get when people start getting really sick. They get sick from bacterial infections of the blood, what we call sepsis, when they've been in car wrecks, when they've been in ICU for a prolonged period of time. And it's not really clear what's going on. It does appear to be some malfunction of our blood clotting system. When people get DIC, getting DIC is far worse than just going into the ICU. It's far worse than getting intubated. It is a significant problem. Don't think that gives you a good answer because I don't think we know. I don't think the answer's out there. Karen Black, good morning, Dr. Brewer. Good morning, Dave Murphy. How are you? Thanks for joining us. Eric Dixon, good morning, Doc. Peter Clark, one of my daughters is 10 weeks pregnant. I'll pass this along to her. Well, I am glad you did. I think we're going to have a short morning this morning. Unless other folks have comments or questions, we will.
Doc, maybe while we're waiting, you can inform them of our topic for tomorrow, finding effective treatments for COVID-19.
So thank you, Carl. Yes, so tomorrow we're going to go back and do some update on the treatments for COVID-19. As many of you know, there's a lot of things that we've tried, that we've used out there, starting with combinations of supplements and prescription medications like zinc, quercetin, which is a chemical that comes from fruits and vegetables, hydroxychloroquine and chloroquine. The reason that hydroxychloroquine and chloroquine work appear to be associated with the same reason that quercetin works. All of it has to do with helping zinc ion get into the cell, where it slows down the replication, the viruses hijacking of our immune system within the cell and our genetic system within the cell. There have been other treatments, as I've mentioned earlier, remdesivir. You haven't seen a whole lot of significant clinical trials about remdesivir yet. You are seeing it used. It's an antivirus drug, and you see some. You've seen a lot of use in terms of last-ditch effort to try to keep someone alive. There have been other trials of things like vitamin C. There have been trials of BCG. Or they haven't been complete trials yet. There's been large, completed, formalized trials. And that's why we continue to see the updates and developments. Jackie Shaheen, I'm not pregnant, but be a naturopathic practice soon. Interested in all aspects. Dave Murphy, I like the new starting screen comparing CVD deaths to COVID-19. Any way to pull off the numbers of COVID-19 deaths due to COVID CVD comorbidity? That's a great question. Obviously, Dave, that raises that next question. So, you've got COVID-19 deaths, you've got cardiovascular prediabetes deaths. We know that there is a huge overlap. And here's the way we got those deaths. We're doing the COVID-19 deaths off of the Hopkins website and a couple of the others. The cardiovascular deaths, there is no gold standard for tracking that, and we don't track that. So what we have to do with the cardiovascular is take the estimates given from each year. So as you know, we know that there's a huge overlap between the two, and that's the question I have. And if anybody's got an idea, I certainly don't, on how to put those two together in sort of a Venn diagram. Or will that be available until further in the process? Well, that's the whole point. I'm not seeing a whole lot of other. Chuck K, good morning. I really appreciate your perspective on this virus. I'm sure holding daily videos is very time consuming. Yes, it is. It was taking up a major portion of my day. And there's still, as much as I stumble around, there's still some stress associated with trying to get up in front of a crowd and talk like that every day. So at the end of that process, I'm burnt for a while. But we also have patients most afternoons, and we're also now doing work for for a large employer and working with a software company in terms of taking that work for that large employer and being able to develop a broader application for other employers. That work, by the way, is how to get folks back to work. So as you can tell, I'm not having any problems getting back to work. I'm happy as a clam working out of my my home, but it's not really that much of a retirement. I'm glad of that. I don't think I could just retire and sit around. Wouldn't be interested in doing that. This is has been a wonderful opportunity for me personally to contribute. Jonathan Hull. Realistically, even if government reopens the economy, should we still self-isolate? You know, I think you're starting to see even comments from multiple people within the government who are starting to say, look, it's not going to be a single, okay, everybody in the country goes back out and starts doing what we were doing 6 months ago. It's going to be sliced up in terms of individual regions, individual states, individual population centers within states. They're going. In fact, we've had several videos on it. One of them, I had to take WHO out of the title because everybody loves to hate on WHO right now. It was a video that we did on the 6 criteria that they said before returning. And again, all of these criteria have to do more with the region than anything else. Is there evidence of continued transmission going on in that region? Are the hospitals overloaded in that region? Then you start talking about for yourself, you know, what age are you? What are your comorbidities? What is your job? What a part of your job requires you to be doing what? So for example, if you look at me, I can see patients, I can consult with employers, I can do videos all from my home. I've got a lot of patients and friends that are dentists. They can't do their work and remain in isolation like I can. We did a video recently with Doug Thompson. He's the dentist that started the Wellness Dentistry Network, and he's focusing on learning and starting and providing a remote dental consultation practice. He's done it already for several of my patients. He's obviously not doing dental procedures. What he's doing is helping educate people, examining them through pictures, remote means, in terms of just taking a look at their gums. Because what goes on with your teeth is really, I'm not a dentist, but I can't help but say this. Maybe I'm not. It's not as important to me as what goes on with your gums. And the taking care of your gums, which is very much involved with systemic health. It's called oral systemic health, and that's what the Wellness Dentistry Network is all about. Once you get involved in that, you begin to see that dentists like Doug can do a heck of a lot of good for people's health from their home in remote means. And again, that just turns everybody's head upside down in terms of, well, what does a dentist really do? Everybody thinks the dentists do drill, fill, and bill. So a dentist is maybe making more money when they do drill, fill, and bill, just like a doctor's making more money when a doctor's running procedures. But by far, the most important thing that a dentist or a doctor can do is educate our patient, because nothing we do to a patient is as important as what the patient knows and how they manage their lifestyle. Robert Simpson, hello, Doc. You're so awesome. Thank you very much, Robert. I appreciate the acknowledgement. Dave Murphy, will a YouTube search bring up your berberine videos? We've got some old ones. We've got 2 old ones, and yes, if you should be able to find it if you go YouTube, Ford Brewer, berberine versus metformin, or berberine. And again, we're working on improving the quality, improving the research on it some, and most of all, improving the video editing. As we've noticed, I'll be the first person to say that we've come from some very, very sketchy background in terms of the editing quality of our videos. My typical video for 2 years was holding up a piece of paper and pointing things out. So we're trying to get into the 21st century. Thanks for asking. And Dave, if you can't find it, just doing a quick Google search on Ford Brewer YouTube metformin. Ford Brewer YouTube berberine. Give us a call. We've got a nurse now. Her name is Lori. And Lori has been doing a lot of work getting up to speed on supplements, and she's helping me with our supplement program. We've got a much better organized supplement program than we used to have. We used to have a system where I would basically just spew out a lot of information and data, but people would say, okay, I got all that. You hit me with a whole bunch of research and facts, but I'd just like to order some. Can you help me do that? And the answer was, well, no, I can't help you do that. That's not what we do. So again, we've had a lot of places where we've needed to improve, and that's an area where we're doing that. We've actually got systems now where if you say, look, doc, I'd just like to go ahead and take the supplements that you're taking or take the supplements that you recommend for the conditions that I have, we've got an easy button for that now. It's a simple, easy button. We send you the information through I forgot what you call these companies, but there are companies that'll do that for us. And we've got those. Lori can walk you through the process. It's a great question. Thanks for asking. Dave Murphy, thanks for all you and your team are doing. Thank you very much for the recognition. We enjoy it. Sometimes we get a little bit frustrated, and as Jerry Kurth, one of our key volunteers right now, very, very smart, very acknowledged and experienced video editor and supplements guy. Jerry actually built a supplements program for a Harvard doc, and he's been doing a lot of work with us in several areas. Again, coming out of his retirement to help us. As Jerry would say, I'm the source of most of our pain in terms of our team and our organizational issues, but like my grandma used to say, even a blind hog will get to the nut sometime, sooner or later. Chuck K, good point, Dave. Michelle and the team are very helpful and very efficient. Thank you for sharing that. I appreciate that. Brian Smucker, what about the new berberine video? Is it available now? No, that's part of the problem. And that's part of the changes. That's part of my organizational challenges. So here's the way we used to do it. Back in the old days, for the first couple of years when it was just me, Janice would go out to exercise and to a few meetings every Saturday morning. I would and she'd be gone for 4 hours. So I'd get started about 8, and by 12, I would have done the research, found the pictures for the shaky paper, and done the videos on 4 videos. Then I'd schedule those for automatic release through the rest of the week. And then, Janice would come home and she and I'd spend the rest of the weekend together. Those videos would be released, and I'd go back to work, my day job, on Monday through Friday. That's not the way it works in a higher end type of production like what we are developing. I will do the deck. I will then go back and record my end of it. And then we have some editors. Carl has brought some of the first improvements to the editing. We're talking with a couple of other editors right now. Aspen's been doing a lot of work for us. And again, Jerry's been heading up all of that process. So I still do the basic research. I'm now doing PowerPoints instead of just holding up shaky paper. And so it takes a little bit longer to organize around that. But again, it's a much easier to watch, much classier video product. And so it gets the eyeballs and attention of people other than just plain old biomedicine geeks. So you asked me a simple question. Is it available now? The answer is no. And that's why. When will it be available? We've got so many things going on in our schedule right now. It might be another 2 weeks, maybe a little bit longer. Depends on how Jerry manages that production schedule. Thank you again for your interest. Let me see if there's anything else we need to, I don't think that's it. Oh, okay. What? Yep. I think that's it. Thank you so much for your interest today.